Health experts both here and abroad have been warning through the year that as the winter months and flu season approaches, it could bring with it an upsurge of COVID cases, and this week that appears to be so. The number of daily new cases in Israel has risen sharply to over 750 the last couple of days, with over 130 now diagnosed as severe. The situation even more serious in France, in Europe, especially France, which now reports over 50,000 new cases a week. And of course, China continues to struggle with the rising opposition to its lockdown approach. In fact, earlier this week, Israel's general counsel in Shanghai, Eddie Shapiro, described on Facebook the virtual imprisonment he had to endure at a Chinese facility after being diagnosed with COVID. Well, joining us in studio is Professor Cyril Cohn, head of the Laboratory of Immunotherapy at Bar-Ilan University and member of the Advisory Committee for Clinical Trials at Coronavirus at the Ministry of Health. Cyril, always a pleasure to have you back. Unfortunately, the circumstances are... okay, so clearly COVID cases are on the rise. How concerning in Israel should that be?
So far, I would say that I think the situation is still under control, meaning that we don't see a big rise. I have to tell you that, the number of daily cases is not really indicative of what is happening right now. We are more watching actually carefully the number of severe disease, people with severe disease. And here, again, we are around 150. There are some fluctuations. But
so what's the real, where should the red alert, what number should the red alarm bells go off?
I think that from the moment we will go over 200, I hope we won't get there, but 250, 300, I think things will be definitely very serious if it's the case, because the problem we have now is that we have also, COVID, but flu.
Right.
And this is also what we are seeing in Europe.
Well, let's talk about Europe. Why is it so bad in France now? And is that a taste of potentially of things to come?
So we are wondering, actually France, cases are going up. Even the latest count showed something like 100,000 cases. I mean, it's a lot.
Wow.
It's a lot. I don't know if we can rely on those numbers. Again, not everybody is getting tested. But again, there is, I would say, hospitals are getting overwhelmed. I would say the head of the emergency services said that, if it continues like that, we are walking, towards...
But why? Why is it spreading so fast there?
There is, that variant, the BQ1.1,
yes,
that is spreading very fast in Europe. It is also, the major or the dominant variant here in Israel, but I think that people now are getting, more together,
right,
indoors, etc. What we don't see here right now in Israel, because in Israel I have to remind you that the temperature is around 20, 25 degrees Celsius. In Paris, I was there just 2 days ago, it was 2 degrees.
Wow. And the variants, of course, is raging through China. What is the danger that there will become yet another serious variant that will be resistant to the existing vaccines in terms of symptoms?
Yes. So basically what we know so far is that the variants we are seeing are all of the Omicron's family, meaning that these are variants that can spread quite fast, but they don't cause a lot of severe disease. Still, even if they are less lethal than what we knew beforehand with the Delta and the Alpha, they can kill people, especially the older people and the people with vulnerabilities. So right now, if we stay with the same family of variants, we can say that, the trend of the disease will be as we knew. But we are always afraid that a new variant will arise. We don't see right now, anything that points toward that direction. But I have to remind you that, at some point we had, flu, and suddenly the Spanish flu, which was a variant,
right,
very, very problematic.
So briefly, I'm
yes,
over 60, healthy, had 4 shots. Should I get a booster shot?
I think that right now the indication is mainly for people over the age of 65, 70,
okay,
or people with, I would say, comorbidities.
All right, and everybody should get a flu shot, I think, right?
Yeah, that, I got mine, I think.
I definitely got mine, so go out and get your flu shot if you haven't gotten yet. Professor Cyril Cohn, thank you for that.